Do you have a lot of numbness or tingling in your hands? I do, and I've actually had surgery for carpal tunnel on this hand. In today's Medical Minute, Dr. Richard Busch from Busch Chiropractic is here to talk about non-surgical ways to treat it. Always good to see you, Doc.
It's always great to be here.
We should have talked years ago.
I know. Actually, and I should have given you a heads up that this is what we were going to talk about today, so you could bring some of your own props.
I call them my bracelets.
Exactly.
Right, I sleep in them.
When we talk about neuropathy, why don't you tell me a little bit about the feeling or sensations that you get?
It's tight around here, around the wrist. Pain shoots through the fingers
Right.
sometimes. Numbness. It's like somebody hit me sometimes, and it's
Like a
just
funny
numb.
bone.
Yes.
Yeah, and then along with that, it also wakes you up a lot of times at night.
Like this.
When you're, yes, constricted like that. And so a lot of times, like you've been using in the past, patients will wear braces to actually put their hands into a little bit of extension to take some of that pressure off of the carpal tunnel. Now, carpal tunnel is very simply the little area where the nerves go in your wrist. And those nerves go obviously down into your hands and your fingers, and we can see patients with numbness and tingling or burning sensations, but also along with that some muscle weakness as well. And that obviously is very uncomfortable, but at the same time, the other thing that we experience with that is a lot of times you may not be able to grasp things the way that you did
or
in
drop
the past.
them easily.
Exactly.
Yeah.
And part of that's just because there's pressure and damage on that nerves. Carpal tunnel is just very simply a neuropathy, which just basically means that there's death or damage of a nerve.
So how do you treat it without surgery?
Well, first of all, you can obviously do the things that you've been doing. There are different exercises that you can do. You can use ice. You can do stretching exercises. You can just stop doing what you're doing. But at the same time, what we've done in my office, we have a specialized type of a treatment where we can break up scar tissue and adhesions with what's more or less a focused ultrasound. And then along with that, we're using some different laser therapy. And then also manipulation of the joints, so we can actually open all that stuff up and restore as much normal movement as possible.
So there's hope for my right hand.
There's very much hope for your right hand.
Okay.
Exactly.
How long does this last? Let's say if you get some treatment, do you have to keep coming back?
It's a great question.
Once a month?
As far as treatment is concerned, generally we'll see a patient for between 4 and 6 weeks for this type of care. As far as that's concerned, we may see them frequently initially, where we see them at 3 or 4 visits a week for that time. After that, there really isn't necessarily a time limit. But if you're continuing to do the things that you did to actually develop that type of a problem or that carpal tunnel, obviously it's going to come back. So it's a lot easier for us to prevent things from coming back if we can see it periodically along the way.
We could talk about this for a long time,
Yes,
but
we
we're
could.
running out of time, Doc. It's always good to see you.
Thank you very much.
You can learn more about the Busch Chiropractic Center by calling the number that you see on your screen or heading to buschchiropractic.com. And you can normally watch the Medical Minute every second and third Monday of the month right here during our noon newscast. Greg is back with a last look at your 10-day forecast when we come back.